Good morning, everyone. Happy and blessed day to all. Welcome to today's Brownsville Beyond, How Businesses Can Protect Public Health Part 2 webinar. Thank you for joining us this beautiful day. It appears that it's going to rain, and I think that's what's happening, which I on my end, I have a resaca view in my office, and I do appreciate seeing the calming rain coming down, and I hope we get some rain today. So again, we hope that you're enjoying today's beautiful day, and your day is also to a great start. My name is Esmeralda Villarreal, and I am the very proud president and CEO for your local chamber, the Brownsville Chamber of Commerce. During today's How Businesses Can Protect Public Health webinar, we have the great honor to welcome a great friend of the chamber, Dr. Arturo Rodriguez, which is the Public Health Director for beautiful city of Brownsville. Today, we'll be discussing updates on COVID-19 in our city. In addition, we will also be discussing and hearing about Cameron County Judge Eddie Trevino Jr.'s Amended Emergency Management Order, which states all commercial entities in Cameron County providing goods or services directly to the public must develop and implement a health and safety policy. We would love to hear from you this morning. We invite you to communicate your questions and concerns. And utilizing, of course, the Zoom and Facebook chat. I know that many of you are joining us via Zoom, and of course, others have access directly to our Facebook Live. So at this time, I ask that you please, share this great information, start a watch party, let everyone know that there's great information and very educational information for our business community, and of course, our constituents through the city of what's happening currently with the increase of numbers that we see, of course, positive COVID-19 cases that are continuously increasing every single day. Also today, as I mentioned, we are discussing how our businesses can continue to protect their businesses through practicing social distancing, through practicing CDC guidelines and recommendations, and hear from our expert, Dr. Rodriguez, of different methods and of course, different recommendations on behalf of the city of how do we move forward during this pandemic, and how do we do our very best to continue to support businesses, practice social distancing, and flatten that curve. Again, I encourage you to please be very respectful of our platform and communicate any concerns, as we would gladly be able to address them towards the end of today's program. We have allocated between 5 to 10 minutes for a Q&A with Dr. Rodriguez. For those that are unable to join us and or would like to share this with friends that cannot join us, this is a recorded version. So we will be able to share this information later today or tomorrow early morning, in which you can share with other businesses or of course your friends and colleagues. Dr. Rodriguez, it's always a great pleasure to join us, to have you join us in this now webinars, which is it's our norm for right now. We do know that you and your team, and of course our leadership through the city of Brownsville, are extremely busy, being very proactive, being very aggressive in continuing to follow the recommended CDC guidelines or recommendations, and also supporting the businesses and making sure that our businesses continue to remain safe, to practice a safe environment, as we know that there is many concerns when it comes down to our businesses from the actual owners and of course our employees that have to go work every single day, that have a responsibility to be able to provide, of course, to their families. And with that said, as we all know, our governor also has, opened or continued to open for business as we're now in phase 3. And that has, of course, allowed for all businesses to open. Also, the percentages of the actual allowed clientele has increased too. So there's a lot of different changes that we are now encountering. So the conversations that you, I, and of course our mayor had back when we first had the very first webinar through Brownsville Beyond is very different. The environment, the existing situation has drastically changed. One of the things that I continuously mention through our webinars is that we as Texans have become more resilient. We have become stronger, but we also have a social responsibility to practice those recommendations, to wear a mask, to respect others by doing so. And, as we all learn how COVID-19 continues to evolve, we understand that, as we wear our masks, we're protecting, others should we not know that we're a carrier of COVID-19. So, there's so many things that we're learning every single day, and there's so many things that we as businesses are learning, and we're trying to adapt and, and implement in our place of business. So Dr. Rodriguez, again, it's with great pleasure to, welcome you as always to your chamber. Good morning. And once again, thank you for taking the time, as we understand that you and your team are out there very busy right now trying to support businesses, and of course, as a whole, the whole city of Brownsville.
Thank you, Ms. Villarreal. I want to thank you for the opportunity for allowing us to reach the business community in Brownsville. It's been very busy lately trying to communicate to our community what it is that COVID is actually doing in our community. And let me just begin by giving a real quick summary of where we stand today. Cameron County Health Department reported 124 cases for the county yesterday. And of 124, 95 of those cases came out of Brownsville. Brownsville is the largest city in the Rio Grande Valley. So I want to put those things in perspective. When you're dealing with the largest city in the valley that has a very young population, you're going to see COVID take a very unique approach to our community. And what I want to reference here is you have a lot of young people who work in service industry who probably don't have signs and symptoms of COVID, because COVID is a pandemic virus, pandemic being the key word, meaning it was never seen before. And we're experiencing a new virus who no one has built antibodies to. So anyone who comes in contact with COVID will become infected. The the very young people will have no symptoms outward in most cases, but it's not to say that it couldn't be that they're spreading it at a very high rate to others. And as we see that we have over 900 cases in Brownsville alone, and 16 deaths already, or 1,034 cases. I just got the update right now. 134 cases and 19 deaths in Brownsville alone. Keep that in perspective of why we're doing this. We're being aggressive because we're trying to keep the hospital and the healthcare system going. We don't want that chain of healthcare to break down. So 98% of people who get COVID will do very well. They won't need hospitalization. They will not even probably need a healthcare practitioner. But the key to this is what they will need to do is they will need to remove themselves or isolate themselves for at least 2 weeks. That's all we're asking. If you think you have COVID, go home. If you have a fever, do what you can at home, just like if you would take care of a cold for 2 weeks. Why are we being so aggressive with that? Is because the older people, anyone who's above the age of 60 and above, COVID is having devastating effects with this population. And these are the individuals that we're trying to also protect. The mask comes into question, and what about a mask? COVID being a pandemic and the body not having your antibodies, the mask helps to reduce the amount of virus that's going to come into the lungs. COVID specifically is very devastating to the lungs. And the more COVID virus you get into your lungs, even if you're a 20-year-old, the more likely that you're going to have health effects for the rest of your life. COVID puts a lot of pressure on the heart and the lungs. And I'm getting too technical here, but I'm just trying to explain why we're pushing for the mask so aggressively. Don't do it because the health department is instructing you to do it. Do it because later in life, had you not worn a mask, you may still be COVID positive because you rubbed your eyes or maybe something else. But if you can avoid it entering through your lungs, later in life, you're going to be much better quality of life. So the next natural conversation is, how do I protect myself and my employees? Well, we know that COVID is out in the community now. About 3 weeks ago, we were still seeing COVID linked to previous cases. But the last 14 days, we've seen COVID take a drastic increase in occurrences out in the community. So we now need to start thinking about, what policies, procedures do I need to have in place to protect my employees? Uh, One of the things that I recommend is taking the TSC sanitation and disinfection course. There is also a grant being offered at this time to offset some of those costs, and to understand how and you could be cleaning your place of business without shutting down. Um, and if you're going to shut down, it's basically going to be to shut down to clean up your business. It could be one day versus being closed 7 to 14 days. And for that reason, we think that adhering to these practices through a policy and procedure are the right way to do it, because you're investing into your business model, and you're probably going to have a very positive net effect from the community if they see that you're being very aggressive with cleanliness. We continue to see that all over the country, and it's no different here. The business community wants to grow, and people are tired of being at home, and they also want to go somewhere. So the conditions are right, provided that sanitation and disinfection are a priority, including wearing the mask. The other question, I believe, as I'm going through our sort of questions, is what can businesses have the authority to do to enforce at their place of business? The best answer that I have for any business owner is, you own your business. Just like you have developed policies that say no shoes, no shirt, no service, you have every right to ask any of your customers who come in to wear a mask to protect your employees. Because once you have an infected employee, it's going to disrupt your operations. So do businesses have the authority? They do have the authority within their best place of business. And we, public health and police departments, we're not trying to be on people in the sense of giving citations to individuals. The governor made it very clear after the incident in Dallas involving the hair salon owner. So that kind of changed things, but it shouldn't have changed a business ability to have authority over their place of business. That has always been the case, and that will continue to be the case. I will add, if a business is not sure what policies or procedures they could do, they can call our department, and we will share some of the governors or some of the CDC guidance documents that we have. We do have them available at btxcares.com, and we do have them available by email if someone calls us and wishes to have that information sent to them. They're also available on the governor's website as part of the order, and they're very good, and they're very thorough, and they've been vetted by the CDC and the Department of State Health Services. So businesses that want to have authority or a policy can download some of those and start to put them to place if they wish to.
Art, I'm sorry, Dr. Rodriguez. That's so used to calling you Art.
That's fine.
So we understand, and you just mentioned how I know our community as a whole is being very, very proactive versus reactive, in the sense that since day one, and I clearly remember the conversation back in early March or mid-March, when our mayor started, of course, through our commission and our leadership through the city of Brownsville, starting being very aggressive in the sense of flattening the curve. Now, you also, we see that we as a city were the first ones to start the COVID-19 drive-through testing. We constantly see on social media comments and postings of many that have attended, and have had the opportunity to get tested. I know that we've had this discussion before, but would you mind sharing again how we are doing the process for the actual COVID-19 drive-through for those that have yet to have access to this information? I know that we have a website. Is there a phone number? Can everyone go? What's the process? How long does it take? Especially now that we have so many people possibly being infected, right? And they may not know. I think it's very important because we as a chamber, as we educate the business community, the owners, management of these businesses have a responsibility, of course, of sharing this information with their own employees and their families.
Absolutely. So let me answer your question in two ways. The first is that we are already at day 66 of the drive-through. It's been in operations since I want to say the very beginning, or March 25th was our first day of operations. So we've been at this for that long, and we're at day 66. We recently expanded to service into Saturdays. So we're running Monday through Friday, and we just added Saturday. This will be our first Saturday to be able to keep up with the pace of demand. We're also working on adding a few other providers so that we can increase capacity for testing as well. The other thing that we're doing before I go into the drive-through is I'll be sending to you at the end of the day today a list of all the doctors and clinics in Brownsville and the surrounding area that are offering COVID testing. That's something that the community has been asking, and it's almost taken us 5 days to put that list together because it's that extensive. But our internal timeline is that it needed to be ready today by 1, and we're hoping that we can kind of make it pretty, and send it out via email this afternoon. But getting back to the COVID-19 drive-through site stats, a snapshot. Yesterday we had over 200 individuals test. And how did they get to the testing? We have a website called btxcares.com. If anyone wishes to be tested who is having symptoms or has had contact with someone who was positive, they can go and register at the website. The site itself is being monitored by healthcare certified people who will look at the screening side of it and decide whether those individuals could come in or should wait a few more days. One of the biggest misnomers is that someone will go to the website and register, and they will be asked to come 5 days down the road. The question is, why 5 days? I want to be tested today.
Mm-hmm.
Well, keep in mind that this virus, it takes the body about 4 or 5 days for it to be able to be picked up on a test, the blood work or the swab. If you test too early, you probably are going to be a false negative, meaning you probably are COVID positive, but if you came in too early and got tested too early, the test is not sensitive enough to pick up the COVID. So in some cases, depending on how people answer the questions, that criteria is in place. We may schedule you 5 days later. It's not because we're that far behind. It's because we're trying to be medical approach, scientific approach, and get you in when we think the time is right to get you in, so that if you are positive, we will get a positive versus a false negative. So once you register, you're sent an email giving you a time and a date. When you have that time and date, you show up at the Brownsville Sports Park. You will be given directions there how to proceed. The self-swab that's being used is actually a self-swabbing process, a swab that goes up to the nose, and the practitioner gives instructions on how to do that process. You are given a set of instructions to stay home and not to leave your home for a period of days until you get your results. The results vary on the capacity of the laboratory. So why is that critical? We can't tell you how many days it's going to take. It's up to the laboratory to be able to have that test done within a number of days. So what's causing the slowdown? There's a lot of testing going on, and some of the testing equipment that's being put to work also requires maintenance at times. So there are other internal issues going on within the laboratories that may take up to 3 to 5 days in some cases. For the most part, we've been able to get most samples out within 3 to 4 days. But keep in mind that you need to be ready when you test to be out for maybe up to 5 days. That is just the nature of what this test is and taken in some cases. Once you test, you get your results back. If you're negative, then we don't recommend that you assume you're good. We recommend that you continue to practice safe distancing and wearing a mask, because that test is just a snapshot that on that day, you were not yet in contact with anyone who was positive, if you're negative. If you do test positive, you do have an option to continue treatment with our contractor, or you can go and go see your own primary care doctor or provider and get treated by that individual. Now, I want to emphasize that 98% of people who have COVID don't have a very good recovery rate and don't require hospitalization and very minimal primary care. And that's a very good number. The risk comes with those individuals above the age of 60.
Art, you also, just to clarify, how are we helping our citizens, for those that are not, that unfortunately don't have insurance?
So thank you. One of the great steps that the City Commission took is the drive-through has two paths forward. You can sign up at BTX Cares regardless of your insurance status. If you have insurance, we would like for you to be honest and use your insurance. But because we have limited funding, and for those people who cannot afford it, the city currently is picking up the cost for those people who are uninsured. The other question we get asked, Ms. Villarreal, is what if my immigration status is at risk? We don't report any of that. We're not involved in that. So I just want to assure everyone that our intent is to make sure that we're testing for COVID, and that if someone's positive, we're putting them in isolation or in quarantine to stop the spread of COVID. We're not getting involved with immigration or any of those issues.
Thank you. Thank you for mentioning that. I do know that in previous conversations with so many of our leaders in our community, that's a constant topic of discussion, that our citizens may have the fear due to their legal status, of course, in our country, and for whatever other reason that may be, that they may be afraid to go and get this test done. So, if I understood you correctly, there's a clear message here that there shouldn't be a reason as to why we should fear to go get tested. That for those that unfortunately are not covered through their insurance, that our city's covering that cost. And again, for our citizens to get educated, for those that don't have access to the internet, as we know that we're still considered one of the least connected cities in the nation, and some may not have access to the internet. What is the number that they can go ahead and reach someone at the city, or what department should they be calling so they can, talk to someone should they have further questions?
So yes, thank you. So we have the 546 HELP, HELP number. That is our primary call center. If you're asking general questions, we recommend that. We also want to encourage you to go online to our website that has a lot of frequently asked questions on the Public Health Department. Also, Cameron County has a great website for COVID specific questions, as well as us. And then lastly, 542-3437, which is the primary health department line. If you wish to talk to an inspector, if you're a retail or a restaurant owner. We also do free plan reviews. So if you have a COVID plan and you're not sure if it's complete, you're welcome to reach out to our health inspectors, and they will help you complete that plan if you need assistance with that.
Great, and those are wonderful news. So then we encourage our retail restaurant business owners to contact the health department line at 542-4437 should they have a COVID-19 recovery plan and they need further assistance, correct?
Let me correct the number, 542-3437.
Oh, I'm sorry, okay, 3437. I had 44.
No worries.
Now, as we continue the conversation, we know that our Cameron County Judge Trevino, stated that now all commercial entities in Cameron County providing goods or services directly to the public must develop and implement a health and safety policy. Dr. Rodriguez, what does the health and safety policy include, and why is it important for businesses to protect their community and employees?
So I think it's important as a business owner to try and keep yourself up and running. And having a health and safety policy helps to ensure that your employees understand what is the owner's policy, how positive employees will be dealt with. It allows the owner to think ahead of the what if scenarios. What if 3 of my 5 employees are positive? How long do they need to be out? How do I continue to run my business? It helps them to answer those tough questions ahead of time so they can at least have a recovery plan back to getting back to business. We still recommend curbside pickup. We still recommend the social distancing, and we all ask businesses to think of those strategies within their business, especially if the owners are. We have some business owners whose health status is maybe at risk. So if you're a business owner where you think your health is at stake, come up with a health and safety plan that is tailored, customized to your needs as a business owner to protect yourself and your employees. The real cross here is to get you to think ahead for your own safety and your employees, and whether it's even feasible to stay open right now or to operate at a 50% capacity. I know the governor has put 25, 50, and 75%, and then 100% opening. Those are guidance. And the guidance says don't exceed beyond 75% at any given time. But even when we're at 100% opening, a business owner still has the ability and the power to decide whether they want to operate at 50%, 75%, curbside delivery, whatever options they may have. They are empowered to take any of those decisions. As a health department, my role right now is to lend support and to mitigate issues where we see risk existing. And I want to point specifically, I got a national survey this past week, the type of businesses where they've seen the most COVID. And it's been the bars right now and the dance halls, unfortunately. But I'm talking from a national level, not specifically to Brownsville. So we know certain industries that are more at risk than others, and we're willing to share that with retail businesses to show, look, nationally, we're seeing these type of businesses are the ones facing the most risk, and it's possibly what we recommend could be done to mitigate many of those risks.
Now, for those businesses that don't have or don't know how to implement a health and safety policy, how is it exactly how our health department is assisting them? Are there available templates? I asked this because as we have our COVID-19 Rapid Response Small Business Assistance Program, we've created a call center, and we've conducted close to almost 4,000 calls during the past 2 months now. And what we've discovered also that, unfortunately, as we conduct business and we're running our business, at times we never thought, first of all, that we would get this pandemic, right? And we've also discovered that many of our small businesses don't have a contingency plan. How do we assist these businesses during the most challenging times to implement a health and safety policy? Does it require specifics, or is it, like you said, just aligned to their industry so they can have a plan? Because we do know that many of our businesses don't know how to implement or don't have the resources. Not that they don't know, they don't have the resources, and they need additional help to go ahead and do this. Understanding that it doesn't have to be a plan that it's pages long. It's just, again, simplicity, and of course, being very objective of how to move forward and implement it. And then now, if they don't implement it, how is this going to affect their place of business? Are they going to be cited for not implementing one, or are they just being cited for not implementing the usage of the masks?
So, very good question. So on our website at the health department, we have many of those templates, and there's business industry specific. For example, if I'm a restaurant owner, what health and safety policies should I have? There's one for that. If I run a wedding hall, what health and safety should I have? There's a template for that. So we have many of those templates online, If you go there and don't see a template specific to your industry, reach out to us, because we may have that available as well, because these templates are being updated all the time from the state, and we're trying to put them online as quickly as we can, but we're also trying to get a lot of things online at this time. So call us if we have it available. We'll be more than happy to send it out to you via email. Your next question was, the health department's role right now has been trying to support and communicate to individuals about the policy. We have been staying away from giving direct outright citations. We do citations when we have had multiple visits and we see that there are no efforts to reduce the rate of or improve the sanitation at the business. Then at that time would take that extreme measure of citing the business owner, but we're not citing individuals at this time. We believe that the greater good right now is trying to work with the public and communicate and support the businesses. And I think it also brings the anxiety level down about getting cited. So we're really working hard not to be that type of health department. We're really trying to be the health department right now that's lending support, because pandemic and COVID-19 is something that we're all learning through. Just like we're learning and we're going to the CDC every day, we're understanding on our regulated community that they also need time to understand what is going on with COVID.
Dr. Rodriguez, yesterday, if I'm not mistaken, it was yesterday, the city of Brownsville, through their social media page, posted a template, a flyer that was created, with a picture of a mask that stated to, which I'm assuming, and I'm making an assumption, please clarify, that this specific flyer could be utilized at, through business owners at their place of business, and exhibit this at the entrance to one, follow our Judge Trevino's orders, right, of the implementation and wearing the mask. But then secondly, we did learn through the feed that there was a lot of different, of course, comments and feedback regarding that matter. Now, it did state to contact or call 911 should someone who is entering their place of business does not wear a mask. What is the right thing, or is there a specific process for these business owners, which of course they want to continue to provide a service, they want to grow their business during these difficult times, but they also knowing that they have a social responsibility, and of course it is an order. What is the best method, or what would be your advice for them to practice this? But also, we're all very sensitive to this topic. What would you recommend to those business owners, and of course to those clients going in, and of course they have the right to think differently?
Right. So there's three parties here. There's the local government, the individual who has a responsibility, and then the business owner who's somewhere in there trying to make this tough decision. How do I run my business with someone who doesn't wear a mask or doesn't want to wear a mask coming in? There's no easy answer to that. And a business owner needs to choose how much authority they're going to want to put into that policy, and if they're going to turn clients away or not. People who go visit restaurants or businesses, individuals have a social responsibility to respect business owners' authority. And if they wish to have them wear a mask and that's not something an individual's wanting to do, they don't have to go into the store. I'm sure there's other stores that offer a competing product that's out there. The third part comes the role of government, whether it's law enforcement or public health. We've taken the stance that we want to communicate the importance of the mask, not just because we're telling you to, but the why the mask exists. It's a tool that we have right now that is being very effective in reducing the risk of COVID. If two individuals in a room are wearing a mask, it reduces the risk of being contagious by over 90%. So the mask alone is a very effective tool in reducing the risk. For those reasons that I give, it's important to make sure that business owners understand the why on the policy of the mask. Individuals understand why they should respect the business's authority to require a mask. And then the role of government, we could get involved and we will if the business owner calls us. But at the end of the day, there's a lot of power and authority that a business can say and do, just like a no shirt, no shoes, no service. You could deny service to them and say, you're putting me at risk by not wearing a mask, and I'm not willing to take that risk.
And that leads me to my next question. So we've heard from businesses, of course, and I share with the recent question, how they have concerns of how the implementation process, and they're always the understanding that they might, of course, lose business, but they're willing to do the right thing for them, for their employees, and of course follow the orders. Even though they're practicing these, of course, recommendations and orders, there's always, of course, a concern of how our city of Brownsville is implementing the citations. So I know and understand that our city is not out there to cite our businesses, especially right now during these difficult times. They're trying to rebuild themselves. So they basically just reopen for business. They're going through hardships, financial hardships. And again, business owners, small business owners, everyone has become more creative. Everyone is implementing new ways of conducting business. But even then, we've also heard of businesses that have been cited recently. Would you, again, just for clarification purposes, state the process of how the city of Brownsville decides when they're going to citate? What triggers that citation? Is there visits? Are you conducting businesses to these businesses? Is it just a matter of people calling that they're there and they're not wearing their masks? How is it that you're led to actually give them the citation?
So the training that we've done with our inspectors is based on risk. Well, they do a risk assessment, and let me just say, there's some businesses in town that cater to particular older individuals, above the age of 60. I won't get into the businesses because I'm not trying to single them out. But if we go to a place of business and predominantly we see that it's an older population, and we see that business has especially a social gathering nature, and that they've made no attempts to socially distance, and it's a high risk population, we're going to be more on a shorter timeline there compared to other businesses that will probably give them more time to work on coming into compliance, because they are putting more people at risk at a single event than potentially another business that maybe has a capacity of 2 to 5 people in a building. So we weigh many factors. If it's a dance hall or an event hall that can hold, more than 50 people, let me just throw that number out there, maybe 50 people. And we see that there's more people at risk, and there's a lot of social distancing not being practiced. And then the employees don't have access to hand washing facilities. The inspectors weigh all those and put it into a risk. And then we're going to be potentially more aggressive on that timeline, because we realize for every day that business is not coming into compliance, there's more people out there at risk of getting COVID. I hope that answers the question in a way that everyone can understand.
Yes, and other questions that we actually had, including or following your answer, is, so we know that some are getting fined. They get fined. Do they continue to operate business, or what is the actual protocol once you're fined?
So yes, thank you for asking that question. That's a very good question. In some cases where we get a report of a COVID positive employee, we also take a different approach. If we respond and there is in fact a fact found that there were employees positive for COVID, we ask the business to disinfect and sanitize, which usually means closing for a day or two. And in some extreme cases, when they don't follow that, which hasn't been the case, most businesses have worked with us to close down that one day. But then the next step, if they don't do that, is we do shut them down for a day or two so that cleaning can take place. But that's extreme on our part. Normally, most businesses have voluntarily closed the place of business early or closed it for an extra day just to ensure that sanitation and disinfection has occurred.
And, in our case, as a chamber, we've been open since day one. We haven't closed our offices. we still continue to welcome our members should they have, to visit. Of course, following the wearing of the mask and social distancing. But I also want to encourage businesses, that we don't have to wait to go through the disinfection process. We as a chamber just recently did so this weekend, and more of a preventive measure. There are many companies out there, and we welcome them to contact us, or perhaps the city. They have a list of companies that offer these type of services. In our case, as we, of course, have so many people now in our office through our call center, and we continue to conduct businesses, to us, it was very important to disinfect the whole office. And, my understanding through these services, it is more of a 9.9% of, killing all bacteria. And to us, it worked out very well. So, I highly encourage everyone to contact us, or of course our city, for further information regarding these companies. It's more about becoming proactive than reactive. And, we have made a pledge to do so every month, and this also brings a lot of peace of mind to our employees, and they're working in a safe environment. And we're striving to do the very best for our business community as well. So, do you, Dr. Rodriguez, have perhaps any recommendations for those businesses that may not, unfortunately, be able to, at this moment, spend in this, or invest, not spend, but invest in this process? Is there any other measures that they can take, internally through their place of business? We know that, it's very simple. Wash your hands, right? Every 20 minutes, as recommended. Spray, do this. But for those that don't have access to this, and we understand that right now, as we keep on seeing a high number of positive cases, and this is me talking here personally, I've been trying to go to all stores to find wipes. It's been days of going to some companies and forming a line, and going to others as soon as I hear, or someone posts on social media, hey, I found wipes, or I found this. I've yet to find them myself. I'm still searching. So, we do, when we can't find, we do wash your hands, and we spray whatever we can. But anything else that a small business can do right now, if they don't have the proper PPE and they can't find any?
So if you're a business on a budget, keep in mind that there are some things you can do. Number one, you can buy the bulk bleach and dilute it down into appropriate solutions, and break it down into a bottle mixed with water. And we do have that formula on our website, how many parts per water to how many parts bleach solution, and then label it properly. That's the only other thing I would add. You also have other products beyond bleach, like and I just went blank on the other chemical that's being used now. I'll come back to it. But beyond, there's other bleach products that are also disinfectants as well that serve that purpose. So you can buy the wholesale product and then dilute it in parts per million as recommended by the CDC. The other thing you mentioned it is hand washing. You can't beat hand washing. That's already in your budget with your utility bill. And then you also don't have to use the single-use gloves. You can use the dishwashing gloves to do some of this cleaning. And if you already have someone in an employee at your place of businesses, you can get a cleaning template from our website as well as to which surfaces and what type of surfaces the COVID tends to stick around. And I would just say metals and plastic are high affinity for COVID. So if around your workplace you have metal rails or plastic surfaces, those surfaces tend to have COVID tends to want to be in those areas a little bit more. So those are the areas you want to do a daily wipe down, or maybe more often than daily, a few times a day to maintain your risk level low at your place of business.
And thank you for that. So what we've learned today is that we now can find more templates available for businesses based, of course, in alignment to their industry and needs. Now, what we will do, and as a follow-up of today's conversation and recommendations, we'll wait, of course, on you, Dr. Rodriguez, to provide us that list of available resources in regards to site locations for COVID-19 tests. aside from, of course, our drive-through, any other doctors or clinics that offer these services. That way we can go ahead and share this to our social media pages and also to our membership. And then as well, we can go ahead and we can assist you and our city by sharing the different templates available for, as per industry. I think this comes in very handy. I know that, as small business owners or any business as a whole, I mean, you're trying to conduct business, you're trying to run business, you're trying to hire, you're trying to make sure that you still are creating some jobs and you're still trying to do many things, great things. But, what we see or what we've noticed, as I told you earlier, is just that we may not know of all the great resources out there. So we think that we're lacking resources with their existing resources. So we as a chamber make a pledge to continue to support the sustainability of businesses. And with your help, of course, and permission, we'll go ahead and be able to share all these great templates and allow businesses to tap into this resources and make sure that we're doing, our very best to support them, during these difficult times. Dr. Rodriguez, we received a message through our I think it's Facebook chat, and it's more of a comment and comment and question at the same time. And it states, there are people I have spoken to here locally that refuse to wear masks. What can we do?
That's a very good question, because we also get asked that, and internally I've had the same issue. Wearing a mask is a key metric, or it's a key activity to having a barrier between you and the COVID virus. If someone refuses to wear a mask, you have the right to turn them away and say, well, it's that much of a risk right now. Now, let me turn the question around. Some business owners don't believe in the mask. And their employees will call us and say the business owner doesn't want us to wear masks because it's going to scare people away. Those are very tough questions that need to be answered internally by the business owners, what policy and what safety level they're going to operate under. The fact is that COVID isn't playing politics. We may be getting tired of COVID, but COVID is not getting tired of us. And this is a pandemic situation. I don't want to mince words. It's a very serious situation. It's going to spread regardless of what we say and do. The best thing that we can do is control the rate at which it spreads, because it's a pandemic where no other people have the antibodies. We know it's inevitable that we're all going to be exposed to COVID. We just want to slow down the transmission rate enough so that we don't overwhelm the hospitals. So if there's one person who doesn't want to wear it out of 99, well, that individual just needs to come to terms that they're probably going to be COVID positive at some point in their personal life.
Dr. Rodriguez, on behalf of our leadership, our board directors, our great team, we want to thank you again for always being present and being available to educate our business community and what we can do as a whole to flatten the curve, to continue to educate our businesses of available resources, and how, again, as a city, we're building, we're building templates, we're building on education, and that our city is in support of business growth, but also most importantly, that we as a whole are being very aggressive to try to flatten the curve, that we do see how our numbers continue to increase, and overall that we all have a social responsibility, and that it's something that is taken very seriously and not lightly on behalf of our city. And of course, I speak on behalf of our chamber. We genuinely care for the well-being of our businesses, of course, their sustainability, and we generally have a care for making sure that, that we do the right thing, and that is educating the businesses. It is up to the business to take the best decision for their business, as you mentioned earlier, but knowing that we as a city and of course as a chamber are able to provide them with resources. Dr. Rodriguez, is there any final thoughts that you would like to address with our following, and of course our followers and the audience, and most importantly to the business community, more of a message to reassure them that we're here for them?
I want to finish by saying, reflecting on our conversation right now, you're not alone. We want to make sure that we're here to support and provide guidance. We're all in this together. We're a community, and we will continue to play that role. So if you have a question and we didn't answer it or address it today, please feel free to call us or email me. My email is art.rodriguez@cov.us. My phone number is 956-459-7728. And a text to one of my inspectors for questions is something that we can do. As busy as we are, and as busy as I am, I don't want to turn anyone away because we understand we're all in it together and whatever we can do to support each other. Thank you.
Thank you, Dr. Rodriguez. And again, a great, just adding a little more to that message is that we together continue to be Brownsville strong, that we are resilient, and that we now are more closer together, even though we're apart physically. We've come together and we will continue to come together as we learn to adapt to the new times due to this pandemic. So we welcome everyone to continue to contact their local Chamber of Commerce as well at 542-4341. As mentioned earlier, we do have a COVID-19 Rapid Response Small Business Assistance Program in partnership with the Greater Brownsville Incentives Corporation and the Brownsville Community Improvement Corporation and our great city of Brownsville. We all have a social responsibility. Do know and count on your chamber that we are doing the right thing for our business as well. So should you have a need to come and visit, we encourage you to call us, of course, beforehand. And we are, of course, requiring everyone that comes into this building to wear their mask as we do so too. So on behalf of our leadership and of course, I speak right now on behalf of Art. Thank you very much for joining us today. Feel welcome to contact Art. As he mentioned, you can reach him at 956-459-7728 and at your local chamber at 542-4341. We wish everyone to remain safe and have a great afternoon. Art, once again, we thank you on behalf of our board of directors. Have a great afternoon.
Likewise. Thank you.